If you are losing weight after 60 without trying, your pancreas is one organ that deserves careful attention today. Unexplained weight loss is not proof of pancreatic disease, but it can appear when digestion or appetite changes. Other warning signs may include jaundice, upper abdominal pain, nausea, greasy stools, or new blood sugar problems. Pancreatic cancer can be difficult to notice early because symptoms may be vague, mild, or completely absent at first. The goal is not to make you fear every symptom, but to recognize patterns that deserve a proper medical evaluation. In this video, you will learn 7 pancreas warning signs, what they can mean, and when faster medical care matters. You are watching Dr. Edward, where we explain practical health information for adults over 60 in plain language. Today we are focusing on pancreas-related symptoms without pretending that any single sign can diagnose a disease. This is general health education, and new or persistent symptoms should be discussed with a medical professional. Your pancreas sits deep in the upper abdomen behind the stomach, which helps explain why problems may be hard to notice. It produces digestive enzymes that help break down fat, protein, and carbs after food reaches the small intestine. The pancreas also makes hormones including insulin, which helps move glucose from the bloodstream into the body's cells. When pancreatic function is disrupted, digestion, appetite, blood sugar control, and body weight can all be affected. Warning sign number 1 is unexplained weight loss, especially when your eating and activity have not changed much. Weight loss can happen for many reasons after 60, including thyroid disease, depression, medicines, and other illnesses. Pancreatic disorders may contribute when digestion is less efficient, appetite drops, or disease changes develop. A few pounds of planned weight loss are different from a steady, unexplained decline that continues without clear reason. Warning sign number 2 is yellowing of the skin, or the whites of the eyes, a condition commonly called jaundice. Jaundice develops when bilirubin builds up in the body, which can happen when normal bile flow becomes obstructed. A pancreatic tumor near the bile duct can cause blockage, but gallstones and liver diseases are common causes too. Dark urine, pale stools, greasy stools, or itching can appear together when normal bile flow is significantly reduced. New jaundice should be assessed, especially when it appears with weight loss, abdominal pain, or digestive changes. Warning sign number 3 is persistent upper abdominal pain that may sometimes spread through toward the back. Pain from the pancreas has several causes, including pancreatitis, and location alone cannot identify the diagnosis. Severe or worsening abdominal pain deserves faster evaluation, especially when vomiting, fever, or jaundice occurs. Warning sign number 4 is persistent appetite loss, or becoming unusually full after eating a relatively small meal. Reduced appetite is nonspecific, but when it continues with weight loss or pain, the overall pattern matters more. Warning sign number 5 is ongoing nausea or vomiting, especially when it appears with upper abdominal discomfort. Nausea has many causes, from infections to medications, so it should never be treated as a pancreas diagnosis by itself. Persistent vomiting can cause dehydration and deserves medical attention when you cannot keep fluids down safely. Warning sign number 6 is a new stool change, especially stools that look unusually pale, greasy, bulky, or floating. Pancreatic enzyme problems can impair fat digestion, leading to oily stools, diarrhea, and unintended weight loss. Stool changes have many other causes, so persistent changes should be interpreted together with your broader symptoms. Warning sign number 7 is new diabetes or worsening blood sugar control that appears unexpectedly later in life. Most new diabetes after 60 is not pancreatic cancer, but blood sugar changes plus weight loss deserve medical review. One symptom by itself rarely tells the whole story, which is why combinations and persistence deserve more attention. Unexplained weight loss plus jaundice is more concerning than either symptom appearing briefly and separately. Upper abdominal pain plus repeated vomiting may signal pancreatitis or another condition that needs prompt assessment. Symptoms that worsen over several weeks should not be dismissed as a normal or inevitable part of getting older. The pancreas lies deep inside the body, so a problem can progress for some time before an obvious external sign appears. That delay is one reason pancreatic cancer may be diagnosed later than cancers that produce visible changes sooner. Symptoms alone cannot tell if the cause is cancer, pancreatitis, gallstones, medication effects, or something else. Trying to diagnose yourself from a symptom checklist can increase anxiety and delay tests that clarify the real cause. Doctors may use your history, examination, blood tests, and imaging to investigate persistent pancreas-related symptoms. Emergency care matters more when severe abdominal pain comes with vomiting, fever, breathing trouble, or jaundice. The hopeful part is that noticing a new pattern gives you a reason to seek evaluation before months of uncertainty pass. Before I show you what to do next, subscribe and tap the bell for practical health guidance designed for adults over 60. If this topic sounds familiar in your family, stay with me through the evaluation steps and red flags you should know. After the full plan, type 1 in the comments so I know you want more videos about subtle warning signs after age 60. Step 1 is to notice whether weight loss was truly unplanned rather than caused by diet, exercise, or illness recovery. Write down your current weight and compare older measurements so you can describe the pattern clearly to your clinician. Step 2 is to look for symptoms together, such as jaundice, upper abdominal pain, appetite loss, or stool changes. Do not use one symptom to diagnose yourself. Instead, notice whether several new changes began around the same period. Step 3 is to track duration, because a symptom lasting days or weeks may mean something different from minutes. Persistent or progressive symptoms deserve evaluation even when they are mild enough to tolerate during daily life. Step 4 is to observe stool changes without obsessing over every bowel movement or diagnosing disease by color alone. Pale or greasy stools that recur with weight loss or jaundice are more useful to report than one unusual bowel movement. Step 5 is to tell your clinician about new blood sugar problems, especially when paired with unexplained weight loss. Most diabetes is unrelated to pancreatic cancer, but the combination can affect how a clinician views the full picture. Step 6 is to review medicines and recent health changes, because common treatments can affect appetite or body weight. Bring an updated medication list so your clinician can consider drug effects before assuming the pancreas is the cause. Step 7 is to report family history, including pancreatic cancer or certain inherited cancer syndromes when known. Family history does not diagnose disease, but it can change how a clinician thinks about risk and specialist input. Do not request a random scan because of a symptom video. Testing decisions should follow your individual medical risk. Routine pancreatic cancer screening is not recommended for average-risk adults without symptoms or high-risk history. People with strong inherited or familial risk may follow different surveillance plans with specialist supervision. CA 19-9 is not reliable enough to serve as a standalone screening test for healthy adults at average pancreatic risk. Doctors may order laboratory tests when symptoms are present, but results must be interpreted with the full evaluation. Imaging may include ultrasound, CT, MRI, or other tests depending on symptoms, exam findings, and the clinical question. Different tests answer different questions, so the most advanced scan is not automatically the best first test. With jaundice, doctors may evaluate liver, gallbladder, bile ducts, and pancreas because several organs can cause it. If pancreatitis is suspected, blood tests and imaging may assess severity, causes, and whether hospital care is needed. Treatment depends on the cause, which is why the first priority is an accurate diagnosis rather than a home remedy. Pancreatic enzyme replacement may help patients with proven enzyme insufficiency, but it is not a general supplement. Changing diabetes medicine or starting supplements without guidance can create new problems instead of solving them. Nutrition matters when weight is falling, but the safest plan depends on poor intake, malabsorption, or another disease. A clinician or dietitian may suggest calorie-dense foods, protein strategies, or enzyme support when those options fit. Do not force large meals if nausea or fullness is severe. Smaller portions may be easier while the cause is assessed. If repeated vomiting prevents fluids from staying down, dehydration can develop, and medical care should not be delayed. Severe abdominal pain with fever, vomiting, jaundice, rapid heartbeat, or breathing trouble deserves urgent assessment. Call emergency services when symptoms are severe, worsening, or paired with fainting, confusion, or breathing trouble. For non-emergency symptoms, schedule a medical visit instead of waiting months for weight loss or digestive changes. Bring a timeline of symptoms, weight, stool changes, appetite, and blood sugar readings if you already monitor them. These details can help your clinician choose appropriate tests without assuming the most frightening explanation first. The key message is that pancreas warning signs are patterns to evaluate, not a checklist that can diagnose cancer. Unexplained weight loss, jaundice, persistent pain, appetite loss, nausea, stool changes, and new diabetes need context. Many people with these symptoms have causes other than pancreatic cancer, and some will have treatable conditions. Early evaluation can find common problems too, including gallstones, medication effects, diabetes, and digestive issues. Do not ignore a mild symptom, but do not assume the worst before a clinician has investigated the full pattern. Keeping both ideas together helps you act properly, without turning every digestive symptom into a cancer assumption. As a bonus, unexplained weight loss deserves evaluation even when none of the other 6 warning signs is present. Your weight trend may show a health change before the cause is clear, especially when appetite and activity stay stable. A written record of weight and symptoms can make a medical visit more useful than trying to remember every detail later. If your body changes without a clear reason, document the pattern and ask for an appropriate medical evaluation. Subscribe for practical health education after 60 and seek urgent care when severe or worsening symptoms appear.